Hello, we are from Group 3. In this video, we will be sharing some information on mushroom toxicity.
Have you ever gone on a walk to the park, then you saw a bunch of mushrooms on the grass? What did you think of? Do you want to pick it up and eat it, or you knew you can't because it may be poisonous? Did you know that many of the mushrooms found in the wild are poisonous? Mushroom poisoning or toxicity is a condition where individuals possess complications after ingesting mushrooms that contain toxins, often in the context of foraging for non-toxic, similarly appearing mushrooms. There are thousands of species of mushrooms, but only about 100 are poisonous and only 10 to 20 are lethal when ingested. However, these poisonous mushrooms often look the same as the non-poisonous ones. Therefore, more than 95% of mushroom toxicity cases occur as a result of misidentification of the mushroom, as there are no simple rules that exist for distinguishing edible mushrooms from poisonous ones. Poisonous mushrooms contain diverse secondary metabolites that, on ingestion or absorption, results in mild to severe illness and even death. One of the poisonous mushrooms that can be found here in Malaysia is the false parasol, scientifically known as Chlorophyllum molybdites. They are commonly found on lawns and open grass areas. Ingestion of this mushroom would lead to gastrointestinal complications with vomiting, diarrhea, and dehydration. Symptoms occur 1 to 3 hours after consumption and can be severe, but none has yet resulted in death. These poisonous mushrooms do not just affect humans, but also animals. These animals do not have a built-in sense to distinguish what is safe to be eaten and what is not, so they would just chew on anything they see. So, depending on the type of mushroom, some toxins primarily affect the central nervous system and cause related symptoms such as excitation, depression, seizures that may also lead to death. Some milder toxins affect the gastrointestinal system that causes vomiting and diarrhea. For example, mushrooms that contain isoxazole derivatives affect animals within a minute. Meanwhile, mushrooms that contain cyclic peptides take 10 to 12 hours after eating to take effect. There are 4 body systems that are commonly affected by mushroom poisoning. Those are liver, nervous system, gastrointestinal, and kidneys. Affected liver, also known as hepatotoxic, are usually caused by mushrooms from the genus Amanita, which has the toxin amanitin, genus Galerina, and genus Lepiota. The symptoms are mild vomiting or diarrhea to weakness, yellow skin, abdominal pain, and comatose. Hepatotoxicity often causes fatality due to irreversible liver failure. Affected nervous system, neurotoxic, causes incoordination, disorientation, weakness, tremors, seizures, hallucinations, agitation, and vocalizations. These are caused by toxins such as hydrazines and isoxazoles, often found in genus Psilocybe and Gyromitra. Symptoms are usually treatable with proper treatments and medications. Muscarine often causes gastrointestinal complications once ingested. They can usually be found in inocybe and clitocybe species and would cause vomiting, diarrhea, weakness, and dehydration. In some rare cases, it would also cause slow heartbeat and breathing problems. Last but not least, nephrotoxicity, where toxins affect kidneys, has symptoms of increased thirst and urination, vomiting, nausea, and dehydration caused by the toxin aurelinin, commonly found in Cortinarius species. However, nephrotoxicity is considered to be rare.
There are a few toxins that can be found in mushrooms which could cause detrimental effect towards humans. Some of them are Cortinarius species, ibotenic acid in Amanita species, psilocybin in Psilocybe species, monomethylhydrazine in Gyromitra species, muscarine in inocybe species, and GI toxins found in many different species. One will experience nausea, abdominal pains, diarrhea, and severe vomiting post-ingestions of these mushrooms. The known treatments of these toxins are intravenous injections of atropine, temporary hemodialysis, and medicine consumption to speed up the defecation process in animals. The first case study related to mushroom poisoning can be reviewed when a family in Jordan consumed fresh mushrooms for lunch, and they experienced nausea, abdominal cramps, and vomiting 6 hours after consumption, and one of the children deteriorated and died after 3 days. The next case study is where a 73 years old male patient was admitted to the emergency room with abdominal pain, nausea, and vomiting. He reported ingesting a type of mushroom known as termite by the local people 20 hours previously. He was diagnosed with acute pancreatitis when a small amount of peripancreatic liquid were observed. Public awareness must be done to educate people on mushroom poisoning, which mushroom ingestion may be fatal when consumed, and edible mushrooms may become toxic at future times, and the banning, picking, and ingestion of wild mushrooms. The positive impact from this effort could be seen from the decreasing rate of accidental mushroom poisoning in humans.
Thank you for watching this video and have a good day.